the human body frequently exhibits subtle symptoms of more serious health issues, and early detection of warning indication is essential for prompt response when it comes to stroke. In this video, we will discuss the 10 warning signs of a stroke a week before it happens. Stroke, also known as brain attack, happen when blood flow to the brain is interrupted, damaging brain cells. Although they can happen suddenly, there are often warning signs prior to the event, and being aware of these signs can help prevent or lessen the effects of a stroke. 1. Difficulty in sleeping. Challenge sleeping. Sleep is a crucial element of general health, and changes in sleep patterns can act as a subtle but substantial warning indication of potential stroke risk. The complex association between cardiovascular health and sleep quality has been made clearer by recent studies. Sleep disorders such as having trouble falling or staying asleep might increase the risk of strokes by raising blood pressure and other cardiovascular issues. An elevated risk of stroke has been associated with sleep disorders such as sleep apnea, which is characterized by breathing disruption during sleep. Sleep apnea-related intermittent oxygen deprivation can alter blood pressure and oxygen levels, which can foster an environment that is conducive to the development of a stroke. Acknowledging the necessity of managing sleep issue is crucial as they can serve. 2. Change in behavior and mood. Alternations in behavior or mood, subtle behavioral or emotional changes can be early markers of neurological issues that may result in a stroke, such as abrupt irritation, unexplained mood swing, or cognitive function. Alternation may indicate abnormalities in brain activities. Given these alternations and the possibility that increase the risk of stroke, a thorough medical evaluation is necessary to find and treat any underlying issue. Conditions including melancholy, anxiety, and even cognitive impairment are linked to behavioral or emotional changes that may have vascular or neurological origins. 3. Dizziness or vertigo. Sudden episode of dizziness or vertigo may indicate more than just a passing discomfort. They may be a result of temporary acid attacks or decreased blood circulation in the brain. Many refer to them as mini strokes. These are cautionary indicators that must not be disregarded since they point to a temporary blood flow disruption to the brain, making emergency medical intervention more urgent. Moreover, orthostatic hypotension, a condition in which standing causes significant drop in blood pressure, is linked to dizziness. Given the complexity of dizziness and its potential as a sign of more serious neurological events, it is important to monitor and investigate these symptoms. 4. Speech changes. Speech problems such as slurred speech or trouble forming words are well-known signs of stroke. Regular blood flow is essential for the language centers of the brain, and any disruption can cause audible alterations in speech patterns. Noticing these modifications can present quick medical care can significantly impact a prospective stroke outcome, since prompt intervention can reduce long-term brain damage. Speech abnormalities can also show up as trouble understanding unspoken language or coherently expressing thought. These linguistic difficulties underscore the complex relationship between stroke risk and neurological functions, emphasizing how urgent it is to address speech-related warning signs that remain unexplained. 5. Unexplained fatigue. Excessive exhaustion that does not make sense can be a mild but serious warning indication of an upcoming stroke. If weariness cannot be explained to lifestyle variables or transient stressful, it may be a sign of underlying neurological or cardiovascular issues. The discovery that there may be a connection between excessive exhaustion and the risk of stroke emphasizes the need of looking at fatigue as a condition other than the result of a hectic lifestyle. Exhaustion can be linked to disease like anemia. An immediate risk of stroke might be caused by heart issues or sleep disorder. Although headaches are a common ailment that is chronic and severe, recognizing fatigue as a potential warning sign highlights the need of a thorough medical evaluation to identify and address underlying variables. 6. Persistent headaches. Attention should be paid to headaches that differ from a person's usual patterns, since they could be a sign of vascular abnormalities that raise the risk of stroke. Tracking the type, frequency and severity of headaches become essential for seeing trends that can point to underlying issues that need to be treated by a doctor. Stroke headaches are frequently characterized by their abrupt onset and extremities intensity. They may also be accompanied by other neurological symptoms like vertigo or vision problems. The complexity of headaches as possible stroke event precursor highlights the significance of differentiating between headaches that are normal and those that could indicate elevated cardiovascular risk. 7. Numbness or tingling. Sensitivity or tingling painful sensations, particularly on one side of the body, may be a sign of neurological issues. These sensations frequently stem from impaired blood flow or nerve function, emphasizing the necessity of prompt medical evaluation. Such symptoms could be linked to disease like coronary artery stenosis or peripheral arterial disease, both of which raise the risk of stroke. Tingling or numbness can affect any area of the body, such as the arm, legs, or face. Identify these alterations in perceptions as possible markers of underlying vascular issues emphasizes the significance of obtaining medical attention to assess and treat neurological issues. 8. Increased blood pressure. Elevated hematocrit. One known risk factor for stroke is hypertension or high blood pressure. Blood pressure gauges the force of blood against the wall of the arteries, and persistently high readings can harm blood vessels. This harm consistently raises the risk of a stroke. Frequent blood pressure monitoring is essential because it enables prompt detection of hypertension and make medication or lifestyle changes an effective management strategy. Numerous variables including genetics, lifestyle design, and underlying health conditions can contribute to high blood pressures. 9. Changes in heart rate. Variations in heart rate, palpitations, or irregular heartbeats may be a sign of underlying cardiovascular issues that raise your risk of stroke. Blood clots can form as a result of disease such as atrial fibrillation, which is characterized by irregular cardiac rhythms, raising the risk of stroke. And crucial part of maintaining cardiovascular health and lowering your risk of stroke is keeping an eye on your heart rate and recognizing any abnormalities. Heart disease or other systematic issues can have an impact on changes in heart rate, as can lifestyle choices. Then, vision disturbance. Vision including heavy vision, abrupt loss of vision, or visual disturbance may be a sign of an oncoming stroke. These symptoms may be brought on by impaired blood supply to the eyes or by the neurological conditions that impact the processing of visual information. Understanding the significance of vision disturbance as possible signs of an approaching stroke emphasizes how crucial it is to get medical help right away. If these changes happen, vision abnormalities linked to stroke can cause additional neurological symptoms in addition to affecting one or both eyes. Understanding the warning indicators of a stroke entails sophisticated comprehension of the range of symptoms that can appear singly or in combination. Even while these indications may be useful, stressing that a stroke does not always result from exhibiting one or more of these symptoms is vital. Seeking prompt medical assistance and in order to address and manage potential stroke risk, speaking with a healthcare professional is crucial. People who are worried about their health or who are exhibiting particular symptoms should speak with a licensed healthcare provider for a thorough assessment and suitable advices. This material should not be used in the place of expert medical advice, diagnosis, or course of action. I hope you found the information interesting enough to click the like button, join the channel, and turn on notifications, and forward the video to your friends and family.